you're going to perform unit inventory with your clean over gloves on, and on the side of the cabinet door, you're going to see that it outlines for you what supplies belong in what area of the cabinet. So you're looking for masks, gloves, cups, mouthwash, etc., whatever you may need. And so Mark is looking and he's saying, oh, I need an extra pair of overgloves. So he's going to go to Central Supply and he's going to obtain the overgloves from the cabinet in Central Supply. And remember, we talked about the fact that you're going to look at those cabinet doors to determine what supplies are kept in what area in Central Supply. So with his clean overgloves on, he's going to Central Supply, he's opening the cabinet for overgloves, he's bringing the overgloves back, and he's going to place them on a paper towel on top of the counter. Because Central Supply is potentially contaminated, he's removing the overgloves that he went into Central Supply with. He's doing a 2 20-second consecutive wash rinse. He's going to put on clean overgloves and then put the supplies away. So when you come back from Central Supply with anything, it goes onto a paper towel on the counter. You remove the overgloves you had on. You do your 2 20 consecutive wash rinse, put on your new overgloves, and then you would put the supplies away. Once he's completed doing that, he's going to then begin the true cleaning, the sanitization, and the disinfection process of the unit. Unit inventory is critical in order for you to have the supplies that you need to treat your patient throughout the day. If you open a cabinet door after you begin working on your patient and you find out you don't have cups for disclosing solution, cups for pre-procedural rinses, bibs to put on the patient, you have to stop what you're doing, get out of the gloves that you have on with all of the washes in between, and go obtain the supplies that you need. So in anything that you do at the beginning of your day, you should always perform either a unit inventory, an operatory inventory, wherever it is that you're working. So now he's putting on his clean overgloves, and at this point in time, he's going to now put the supplies away. In this case, it's the extra box of overgloves. Questions on that at all? All right, so once he puts them away, he's going to get back into what gloves? He has on clean overgloves. Utility gloves, correct? Those heavy-duty nitrile gloves that are going to allow him to begin that sanitization and disinfection process of the unit safely. So overgloves are away, back into the utility gloves. And remember that we discussed at the beginning of every day when you come in that you should assess the cabinet below the sink to determine if the correct size utility glove is there for you. So he's going to get his utility gloves, and how many times is he going to wash? 220, right? 220. So that everything that you do now with unit preparation or unit breakdown is all part of a sanitization and a disinfection process. So when you're cleaning to this degree, you're always going to be using a 220 wash rinse sequence. When he completes the 220 wash sequence, and again remembering you're watching him going from fingertips to wrist with the lather and the scrubbing, rinsing fingertips to wrist, repeating the process, and then a wiping of each individual hand, fingertips to wrist with separate paper towel, wiping up the area to avoid any puddling of water. So once that process is completed, from your reading, do you remember what you're going to do next? How is he going to disinfect the unit? What supply will he use? Right, wipes, located right there at the sink, correct? In that container. So what he's going to do when he's done is put down 2 paper towels on the countertop, and he's going to pick up the wipes canister, and he's going to look at the wipes canister. He's going to look for an expiration date on it to make sure that it's still effective, and he's also going to slightly agitate the container to allow the disinfectant to work through the wipes effectively. So paper towels onto the countertop. He's going to pick up the canister, look at the expiration date on it, and then he's going to agitate the can to ensure that the disinfectant is flowing through the wipes. Lifting out one of the wipes from the top, he's lifting the top off, pulling out a wipe, placing the canister on one of the paper towels, and with a single wipe, he's going to begin the sanitization process of the wipes container. He'll begin at the top of the container, and he'll work his way from the top to the bottom. So the top will get wiped, the sides will get wiped, and the bottom will then get wiped. And when he's through wiping it for the first time, it will go on the clean paper towel. He'll discard the paper towel that it was originally on, and the disinfectant wipe that he utilized. He will wash 220s because right now he is moving from a sanitization wipe to a disinfection wipe. So we've cleaned off the debris, and now we're looking to actually disinfect the canister itself. So after the 220-second wipe, he'll wipe it again, top, sides, bottom, because everything that we do is from a top to a bottom or from a front to a back, moving all of the microorganisms that we want pushed away from the patient as far away as possible. We don't bring anything toward the patient area in this particular wipe. So he's completed. He'll do the disinfectant portion of the canister, and then he's going to put that canister right back down on the same paper towel. Questions on that at all? So the first process then is the canister, the sanitization and the disinfection of the canister, because if I don't do that, I'm not ready to proceed with the remaining areas for wiping. So the disinfection wipe will occur now. And you can see that sometimes the wipes may tear off when and not come through the hole quite as well as you want them to. You just have to go into the canister and re-thread it and bring them out. So the top, the sides, the bottom, he's discarding the wipe, and then he's going to move to turning on the unit, the master switch, which is on the side of the bracket tray here. He's going to pull the foot pedal off the base of the chair, and he's going to remove what we call the rheostat from the top of the chair along with the paper towel that it's sitting on. If he doesn't, they're in our way when we begin to disinfect that portion of the unit very shortly. And then what he's going to do is flush the lines at the unit for 2 minutes to remove any stagnant water. So the air water syringe from the bracket tray, and then the cup and the cuspidor buttons will be depressed to allow the water to flow through those for 2 minutes. So the water button on the top of the air water syringe, and the cuspidor and the cup buttons on the top of the cuspidor there. When the water sits and remains stagnant overnight, or it could be, in this case, this unit may not have been utilized since the end of June. You're building up quite a bioburden in the lines there, so you want to make sure that you're flushing them so that the water that you're utilizing for your patients is clean, flowing water. So that's a 2-minute sequence, and it takes a while to do that, but you will find that it is extremely necessary and important for you to accomplish that. So 2 minutes with the actual depressing, and you can see that you have to continuously depress the buttons in order to get the water to flow. Some of the buttons will run a little bit longer at the units than others. You'll learn how your unit actually operates and how frequently you're going to have to continue to repress those particular buttons. The air water syringe button, you'll see on the top there is one button that has a little water droplet above it, and then there is another that has a little cloud of, looks like air above it. One is for air, the other is for water, so you'll press the one with the droplet. So at the end of 2 minutes, he's going to wash his hands again for 2 20-second consecutive wash rinses, because the cuspidor is a highly contaminated area. So we don't want to proceed with the beginning of our unit preparation sequence of sanitization wipes with gloves that have been in a highly contaminated area, because where we're going to begin is the top and the areas that are much more related to the patient treatment and touch than the cuspidor area. So once he completes his wash, he's going to dry again, and then he's going to begin the wipe where? Where do you believe the wipe will start? At the light, correct? That's the highest part of the unit. So everything we do again is top to bottom, and we do all top surfaces first. We would wash and then continue with all of our base surfaces. That's done once for sanitization and then again for disinfection. So he'll begin at the top of the light, and he'll begin with the face of the light. And what we want to make sure we do is that if the disinfectant wipe is really saturated, we'll squeeze it out just a little bit because we don't want to allow the disinfectant to flow down inside the light into the electrical part of the light. But starting from the top to the bottom, and so you see you're moving the handles on the light, handle top to bottom. On each side, you'll do the front of the light, top to bottom, the back of the light, top to bottom, and then the yoke that connects it, top to bottom. And see how he's pushing now up and away from the patient. So we're moving now along the light pole, back and away from the patient. And long sweeping strokes. See those long sweeping strokes? They're more effective and in terms of time management as well as effectiveness of removal. So continuing on to the light pole and then over to the ultrasonic unit on the other side. He'll do the top of it, the sides of it, the cords around it, and the base on which it sits, top and bottom. If those cords were dangling down, he would wipe the cords to the base of what we call the evacuation box right here as a top surface, but they're not. They're wound up. So again, continuing underneath, remainder of the light pole right to the knuckle joint at the evacuation box, including that little knuckle joint to finish the light pole. When he's complete with that, he'll move back over to the bracket tray, beginning with the actual tray on top. He'll wipe the top of the tray, the sides of the tray, the back of the tray. He'll wipe the top of what we call the skid pad that holds the tray onto the actual unit. On the top of it, he'll wipe it, and then he'll pick it up and turn it over and hold it with his thumb on the bottom of the tray to wipe the bottom of it. And prior to placing it back on the unit, he'll wipe the top of the bracket tray in one direction away from him. Replace the skid pad, replace the tray, and then he can do the sides of the bracket tray, and then he'll come around to do the front of the bracket tray and the hoses. So we'll do the sides, including any handles there or buttons. And then he'll come around and do the front of the tray, including the bracket arm and any of the items that are in the front. Like right now, the air water syringe beginning at the top, and he'll move directly to the back in one sweep. He's wiped the receptacle in which it sits. Your slow speed handpiece hoses, again wiping top to bottom. He's already wiped the receptacle in which it sits, and he's ready to put it back. And you see that long sweeping one direct motion away from the patient. When he completes that, he'll do the back of that bracket tray, the elbow behind it up and away, and then the arms of the bracket tray all the way over to the evacuation box. So the back is being done top to bottom, the elbow is being done, and now the long sweeping strokes that go along that bracket tray arm, completing it all the way over, including that knuckle joint to the evacuation box. So the light is done, the bracket tray is done, and now he's going to move to the next highest component, which is the actual patient chair. So the headrest is being done front and back. He'll then do the back of the chair from down the back, sweeping strokes. Okay, see, covering everything, slight overlap there. Now what he's going to do is change his wipe because the one that he currently has is drying out or becoming soiled, and that's something that you want to look at. Is it soiled? Is it dry? And do I need to change it? So now that where the patient rests will be wiped, the arms will be wiped, the top, underneath, the sides, the outside, the inside, and then he'll come around to the back of the chair and he'll wipe what we call the yoke of the chair and the lever that it swivels the chair back and forth. When he's done with that long sweeping motion, from the back of the chair up to the plastic covering on the seat. When he's done with that, he will then complete it over the plastic, and once he's wiped that plastic where the patient's feet rest, he will discard that wipe because it is a very dirty area where shoes go. Get a new wipe, and he'll begin wiping the operator's stool. So the operator's stool, then, he would start with the top of the back of the stool and wipe that from the top to bottom motion, the front and the back of it, including that back pole and lever. So the seat of the chair, the top of it, the sides of it, the back pole, the lever there, and underneath the adjustable paddles for each one of the stools, which is where your hands will be when you're adjusting the height of it during patient treatment. So that's considered the top of the unit. This is an assistant chair, so again, wiping the top of the back of it, the poles and adjustment levers there, the seat of it, the top, the sides, the bottom, and then the adjustment lever on that, the paddle on that top and bottom as well, as a top surface. So when he's done with that, again, always checking your wipe to see if you need a new wipe, if it's soiled or if it's beginning to wear. And he's now going to go to his next highest portion of the unit. So when you stand before your unit, you own everything to the right. So on this unit, the sink that he would be using is the sink to the right, and it's the only one that's at this unit because it's an N unit. So he's starting at the top, pushing everything away, coming down over the front, and now he's going to go inside of the front area here, wiping the cabinetry itself as well as anything that is sitting there before he puts it back down. So wiping the cabinetry, wiping the area where it was sitting, wiping the soaps that are sitting there, or another disinfectant container that could be sitting there. So sanitization wipe of everything at that sink area and the cabinetry. And then when he's done wiping all of those again, top to bottom, he's going to begin coming out on the top of the sink, including the spigot for the water and the soap dispenser there. And then he will actually go into the sink. So over the top of the sink, over the spigot, top to bottom, inside and over the soap, and he'll do the chrome area there as well on the sink, and then move to the inside of the sink from top to bottom in one direction, and then a sweeping stroke to cover the bottom of the sink. And once he finishes in the sink, he's going to wash 220 because, again, a more highly contaminated area, and prior to moving to the remainder of the top surfaces, he wants to have clean utility gloves. Okay? So you've worked on your top area. So what we were just talking about in terms of what you own. You own everything to the right. So the sink area, the front of the sink, the top of this countertop, everything down to the inside here, drawers that we'll show you in a bit that can be opened. And you also, on the end units, have an additional full cabinet. So you would be washing the backsplash, the tops, the sides, the front, and all the interior drawers. At another unit where you might have another operator to your opposite side, that person would be responsible, typically if they're there, for their countertop. You would own what would be inside this area. So they would be wiping this countertop. But if they're not there that day, you would also be wiping the top of that counter as well because it's in your vicinity. So Marcus washed 220, he's through with that sink area, and now he's going to resume remaining the cabinetry with the side of the tower, the back of the tower, and then the countertop. So side of the tower, back of the tower, and then he's going to carefully move around the monitor that is on the countertop there. So moving around it, wiping in a direction away from him. So one direction away, and he's going to continue wiping in one direction away until he reaches that canister and paper towel with the wipes in it. And he's going to place a new paper towel on the countertop, move the canister over, and discard the contaminated paper towel that was sitting on a counter that has not been sanitized. So new paper towel, move the canister, throw out the old paper towel, and he's going to continue wiping the sanitization wipe of the countertop. He'll then move to the doors of the cabinetry, moving top to bottom and completely wiping top to bottom, making sure that the doors are not opening, and you're not to wipe inside of those areas because there are patient treatment supplies in there, correct? So you'll wipe those cabinets, and then you'll move to the drawers at the unit. The drawers on the right side that open are 1, 3, and 5. You will not open drawer 1 because it has the computer keyboard and mouse in it. But you'll wipe all the drawers, and then you will wipe the inside of 3 and 5 because you're going to place your own patient treatment supplies in there. So again, in a single direction, you're moving away from the patient, you're wiping the insides of the drawers. Drawer number 5, you'll wipe from top to bottom, see, going around the top surfaces of all of those on the edges, and then you'll wipe pushing from front to back to continue wiping those drawers. Once you're through with that, you'll continue with the cabinetry doors at the sink area, including the front of each cabinet area. Okay, so if you have a front or a back, depending on the unit that you're stationed at, you may have both, you would wipe the front of this as well. And then he's going to move to this side. We started over there because it's a higher area, correct? That tower is higher, so he would do the backsplash here, and then he would begin doing the countertop because it's a higher surface, one direction pushing away. And then you have your end cap. So he's going to finish down there, and he'll do the end of that cabinet and then come around to the drawers of this set of cabinets. And here, he would wipe, because there are 4 drawers, he would wipe inside each one unless there is a computer keyboard and mouse in the top drawer. And at this unit, the mouse and the keyboard are over there. So this drawer over here should be open. So wiping the outside of the drawers and then wiping the inside of the drawers as well, because I might want to put supplies in those drawers. And if I do that, they have to be sanitized and disinfected. So in an operatory in an office, you would not see the inside of the drawers being wiped like this because they contain the patient treatment supplies, correct? But you would be wiping the outside or any empty drawer where you would be utilizing different patient treatment supplies for each patient. So finishing up with the drawers then, and then he's going to do the front of the cabinetry without opening it, and then completing this set of cabinets with this end cap on this far side. The tops are extensive, correct? There's quite a bit of surface on the top areas. The bases are not as extensive as the tops, but when you're going through this, you have to remember that, again, long sweeping strokes. See how he's going from top to bottom. He's not just getting 3/4 of it, he's doing all of it, and then including the end cap. And then he's going to move to the last sequence of top surfaces, which is in the area of the evacuation box in the cuspidor. So he's going to go to the evacuation box, and he's going to wipe the top of it, the front of it, the sides of it, the back of it, and then he's going to wipe the arm that connects the chair and the evacuation box. So when something drops on the floor, the best thing to do is just get another wipe and keep moving if you don't need what dropped on the floor, and he does not need that right now. So he's going to continue wiping the evacuation box, wiping the arm. He's going to move to the bracket arm over here once he finishes that evacuation box, and he's going to wipe the bracket arm, the receptacle that holds the hoses, and he's going to wipe the evacuation hoses 6 inches down only as a top. The rest we'll wipe as a base. So the high-speed evacuation, the slow-speed evacuation, he's wiping it again top to bottom, 6 inches down, and then he'll move to the final top, which is the cuspidor, and the outside of the cuspidor, top to bottom, over the top of the buttons, then to the cuspidor spigot, and then into the cuspidor, and actually picking up the trap and wiping the trap itself, including the base of the cuspidor, and then replace the trap. And at that point, he'll discard that wipe because it's highly contaminated. The other thing he's going to do is, because he's going to wash his gloves, he's going to pick up the wipe that fell on the floor at this point and discard that right now, and then he's going to wash his gloves. Because if he stops when he drops something and picks it up from the floor and discards it, you automatically have to wash your gloves because you were on the floor with that particular item. So in order to save time, he's going to a washing sequence at that point anyway. So if there's something that you've dropped, that's a good time to pick that up. So that's the top surface completed. So you've completed your top, you would wash your gloves, all right, regardless. If the minute he has finished in that cuspidor, he's going to go immediately to the sink, discard that wipe, and wash utility gloves, 2 20-second consecutive wash rinses. The item that was on the floor, we just picked up at that point in time because it made sense in the sequence to discard and wash along at that same time. So now he's going to begin with the sanitization wipe of the bases. And the sanitization wipe of the bases begins at the 6 inches down on the cords, and these are the only cords that you wipe this way towards the unit. The reason is that the patient oftentimes will be holding these, even though they'll have a plastic barrier on there, they'll be holding these. Sometimes their hands are on these cords, and these cords, when the chair is down, are dragging on the floor, and so we don't want to wipe what's on the floor up toward their hand. So we move where their hand would be towards the unit. So 6 inches down and put a little pressure on them so that they don't fall out of the receptacles onto the floor. 6 inches down on the slow speed, all the way towards that unit. See how that's a single motion moving towards the unit. Then he's going to move to the cream portion of the base of the chair, starting right here at the top of the cream and moving down the sides of it, the front of it, the back of it, and he'll also include the piece in the front. He'll do the top of it, the sides of it, and the front of it. And then once he finishes that cream higher base, he'll begin to use long sweeping strokes over the darker brown piece that sits on the floor. Okay, so that's done, and now with long sweeping strokes, he's going to move down the side to the back, and at this point in time, the foot pedal is there. He can do the cord to the foot pedal and the top of the foot pedal. He'll complete the base over here on the floor, and then he'll begin to wipe the cord that goes to the rheostat. So from the unit out now, this is the cord to the rheostat and the top of the rheostat, and he'll wipe those. He'll then move to the umbilical cord, which is the large cord that houses tubing. He'll do the top of it, the bottom of it, and the electrical cord that's in the front of the unit will also be done at the same time to the utility box that sits out in front, wiping in one direction, the front of it and the sides of it. And then he'll move to the base of the assistant stool that is on this side of the chair. He'll do the metal rungs there and the tops of the rollers on the wheels, so that whether it's an assistant stool or an operator stool over here, and that you'll see he's doing the operator stool on this side first. We'll do the rungs, and then the top of the casters on the wheels, the same thing on the assistant chair, and then he has completed the sanitization wipe of the unit. Okay, so the first wipe of the unit is done, which means now, what should he do? He's on the floor. Right. Discard that wipe, wash his utility gloves, 2 20-second consecutive wash rinses, and begin all over again, starting with the light for the disinfection wipe of the unit. Questions on that at all? Okay, so right now he has just finished sanitization. He would wash and perform that entire procedure again. We're not going to do that again today because we're going to show you a little bit of how you want to realign this unit to get out of here at this point in time, so we can take any questions or have conversations about what we need to for the next session. But what we're going to do right now is show you what would happen. Let's say that this were the end of the disinfection wipe. Okay, this is the end. Let's say he had gone through it again for the second time, and now he's washing his gloved hands. Something has to happen in order for us to get to the next step of bringing the patient treatment supplies into the unit. Okay, we're not going to just get out of these gloves and go get our kit and our instruments and bring it to the unit. We have to prepare the area to receive those things to also sanitize and disinfect our patient treatment supplies. So let's say he's at the end of disinfection of the unit. He's now going to take an additional paper towel and go over to the counter and put that paper towel on the counter. He's going to take a wipe and he's now going to re-sanitize the wipes container, correct? Wipe that canister top to bottom, so the top, the sides, the bottom. He's then going to discard the paper towel it was sitting on. He's going to put that on the clean paper towel, discard the paper towel it was sitting on, discard the wipe, and wash his gloves 220 because he's between the sanitization and the disinfection wipe of the canister, correct? We were on the floor. We were wiping cuspidor areas. That canister is fairly contaminated again at this point. So we know that we're going to now introduce patient treatment supplies to the environment, and we want to ensure that the canister that we are contacting is sanitized and disinfected again. Okay? So the 220 wash, post-sanitization, and now he's moving to the disinfection wipe of the canister. So at that's the point where we're going to stop today for the unit preparation sequence, and then we would pick this up again on Wednesday. We'll go from the disinfection wipe. So here's the disinfection wipe of the canister. So he would wipe again the top, the sides, the bottom, place it back on that paper towel. Okay? And then we'll proceed from there with our unit preparation next Wednesday.